Perfect. Good morning, everyone. I'm Dr. Arrieta, and today we're going to be talking about dry needling. Who has heard of dry needling? Maybe through, advertisements or people are talking about it. Maybe your neighbors or friends are getting it done and seeing fantastic results. Maybe you've heard about it and think it's the same as acupuncture, or maybe you're scared of needles and just don't even want to talk about it. So that's what we're going to discuss today, right? What does it all mean? What is it good for? Differences in, similarities and differences to acupuncture. Who would it benefit, etc. So dry needling is really good for muscular pain. And not only muscular pain, but myofascial tender points. Now that's a fancy word, so we're going to break it down. Myo means muscle, and fascia is the connective tissue around that muscle, okay? So if you can imagine, right, every single muscle in your body has this thin layer of connective tissue, and because it's connective, it's connecting to other muscles right next to it, and then down further the line, and then it goes up, and it crosses the body, and there it's all over, okay? Now we have tender points. So in that muscle, we might have something, if we look at this picture here, the blue lines are normal skeletal muscles, should be nice and smooth and everything kind of looks the same way and goes in the same direction. What we can get, these red ones, is now we have these trigger points that are stretched and tightened bands that are permanently contracted. So if you can imagine, right, you're walking down the street, you're all loosey-goosey, going the right way, everything's feeling good, you're those blue skeletal bands, right, everything feels good. What if something happens and you get in a car wreck, right, now everything tightens up and you're in pain. That's what those red kind of skeletal bands are doing. Another picture is over here. This is a muscle, and then as we see here, it becomes a really tight, so this is a taut band. If we look into there, we have, again, smaller little skeletal bands that are contracting and they're not letting go. Now, we see when the muscle contracts and it won't let go, it squeezes and balls up and sends pain signals to the brain. Well, the brain's like, oh, that hurts, I'm in pain. And so it then sends other signals down, and it continues to release nerve endings, and I don't want to get too technical and scientific, but it keeps telling the muscle to keep contracting. So now we're in this cycle of pain, right, where the muscle and the fascia starts to ball up. It causes nerve signals to the brain saying, ouch, that hurts, I'm in pain. The brain then says, well, I'm going to clamp down. And now it's clamped down even more, and it's just this horrible, vicious cycle. Now, imagine that's happening in your back, or your shoulders, or my knee, or my leg, anything like that. I've been carrying this back pain with me for 12 years. When my daughter accidentally, right, she tried to be nice and give me a massage, and she pokes this one spot, I leap off the couch and I yell. That is a tender point, most likely caused by this, right? The myofascia, the muscle and the connective tissue, are balled up and have created a very tender sore spot that you can find and point with your finger, okay? So that's kind of what we're going to be talking about today. This is the root cause of a lot of this pain, muscular pain, and myofascial problems. It gets confusing because you don't just have pain on that one spot. The pain can be, and this is kind of difficult, but that is a white X. The pain could be right there. That could be a tender point. However, it will cause pain to be in this entire area. Or, similarly, if you have a point right there, it can cause pain this entire area. So it gets kind of confusing. It's what we call referred pain. So you can have pain caused by a specific muscular issue at one point, but that one point then causes pain other places, so it gets confusing. You can have elbow pain, but it's actually caused by a muscle up here. Or I could have shoulder pain, but the point is actually lower down, right? I have a point here, but it actually is causing radiating pain into my neck and head. So we see here we have multiple points, and each of them have kind of a longer area. That's what this on the right-hand side is showing us as well. Her muscle that is injured is this trapezius, which is the muscle, if you point right at your shoulder here, the top part, that's your trapezius. She has a point, and that's the trapezius, right? It inserts into the back of the head and goes down to the shoulder, and it kind of looks like a kite in a way. She has a specific point right there. However, she is feeling pain up into her neck and actually around, and it causes a headache. She sometimes gets it into her jaw. So her pain, right, the area, the referred pain, gets to be very confusing to her. She doesn't know what's causing it until she sees someone and they say, oh, you have a myofascial tender point, let's fix that one point, and now it's fixing the entire thing. Whereas she thought, oh, I got 3 points and I don't know why, but they're actually all related. So this is the little breakdown a little bit more. The nerve, and these are tiny, right, minuscule, we're looking under crazy microscopes here. These are the nerves that come in and innervate the muscle fiber. So this is a very long muscle fiber here. When we zoom in even further, this is the nerve. It releases in these synaptic vesicles acetylcholine, which then tells the muscle contract. Now normally this happens in a split second, right? It happens every time we take a step. Our brain is telling our muscles contract, contract, let go, contract, you know, and we don't think about it. It just happens. But this is the area that's causing the dysfunction because the nerve endings are releasing from those synapses. They're aggravating and causing the muscle fibers to clamp down, right? And they're not letting go properly. So they're constantly being aggravated and turned on. So we use dry needling with the goal of releasing those points, right? It will help to relieve pain, improves the range of motion, because if you're not clamped down, now you can stretch out a little bit more, right? Move your neck a little bit more, move that shoulder, etc. It's going to reduce muscle tension, and hopefully the goal is to normalize this motor end plate, which is the fancy way of saying the nerves innervating the skeletal muscles. And it helps to speed up your return to normal muscle activity. Decrease pain, increase range of motion, decrease all that contraction and tender points that you have, so you can go back to the way you used to feel before all the pain and muscle tension started. Now, this is a couple pictures of dry needling. On this left-hand side, what we start with is our hands. We're looking to find those specific tender muscle contraction points with our hands. So on this left-hand side, that is the area that we're feeling is causing all this little issue. It could be tiny, right? It could be minuscule, but we're feeling for it. So he's reaching over it, he's over it, he's finding out where it is. If it's on an edge, we're able to pinch it. And once we find that location, then we can put the needle in. So the needle on this side, he is again pinching it, he found it, he's holding it with his left thumb. Oh, there it is. He's using his right hand to put the needle exactly where it needs to be. Now, when we insert the needle, the thing we're looking for is a twitch response. Sometimes the patient does not feel this, sometimes the patient does, right? Just like when you get those weird cramps or muscle twitches, and you're like, oh, that's kind of weird, my leg's doing that, you know, it doesn't really hurt, but I feel it. That tells us that we're in the right spot, right? That the muscle is really kind of turned on, kind of aggravated, kind of, you know, it's ready to do something. When we put the needle in there and we get that twitch response, oh, we're in the right spot. Now we can start working and start doing the dry needling. Do we need to do myofascial release before this, etc. But that's how we're able to find exactly where we need to put it, so we're not just putting needles everywhere so you look like a pincushion, right? Now, some people are concerned about what we're using, right? When you hear dry needling, you go, oh, I don't like needles, I don't like getting blood, I'm really scared, they're going to be huge. So we're going to talk about the size of them. On this right-hand side, side, we're going to see this is the matchstick, right? Matchstick's already pretty thin. Then you see a medical syringe. This is what we would take blood from you or give you maybe your flu shot with. It has a hole in it because that's where we put the medicine through or suck the blood out of, right? So it needs to be hollow. Sewing needle is it's even thinner, right? And anyone that's been stuck by a sewing needle, you're like, oh, that didn't really hurt. It kind of like, oh, you don't usually bleed a lot. That's about 1 millimeter. A fourth of that size is what we're using, the acupuncture needle. So now you can see how truly thin this needle is that we're using. On the left-hand side, you're going to see how thin those needles are compared to the model's fingers and the back, so you can barely see them. I'm going to pass around some dry needles that I use. They have a clear plastic tube around them, so when you look at them, look through, and it's that tiny hair-length metal inside the tube. This is how thin they are. So we're going to pass those around, and you'll be able to see, oh, this is, it's not too bad. These are the exact same acupuncture needles that acupuncturists use. So if we've ever had acupuncture, you'll notice, oh, it went in, didn't really hurt, all that kind of thing. Exactly, you got to look a little bit harder because they're hidden in there. That's how thin they are. It is a thin filiform needle, and that is why we call it dry needling, because instead of the hypodermic needles or the medical syringes at the top, nothing ever goes through these needles. No medicine, no liquids, we never suck anything out. They are the thinnest possible on the market because we need to hit those really small muscle points. Because they are so thin, they usually do not cause discomfort or pain, but usually messing with the tender point because it's already tender is what causes that discomfort. But we are stimulating those myofascial trigger points, the muscles and the connective tissues around to help them then release and reset this cycle of pain. Now, since we're using acupuncture needles, and since we are putting these acupuncture needles in the body, isn't dry needling the same thing as acupuncture? Now, this is a controversial topic because there is such a thing in acupuncture called ashi points. Now, ashi points are points outside the meridian. So when you go to an acupuncturist, they have been trained in traditional Chinese medicine. And in traditional Chinese acupuncture, they learn these meridians. So there are lines along the body and multiple points along each meridian or each line. They learn each specific point, what it is used for, the qi, which is the energy, how it flows. If it gets blocked in one specific point on one specific meridian, how could that show up, right, as symptoms? So when a patient comes in to me complaining of nausea, what acupuncture points am I already starting to think of? So they usually keep to a point and keep to a line. However, thousands of years ago when they started acupuncture in China, they noticed that if they put that same acupuncture needle off the meridian onto these ashi points, which is basically, that's the area, that's I think the translation, they noticed that their patient's pain went away. So they have technically been using this quote-unquote dry needling technique for thousands of years. They just never called it that. They called it another point because it wasn't technically, right, acupuncture on the meridian lines. Now, the term dry needling has been coined by Dr. Janet Travel in the 1980s when she started discovering, there are muscle contraction issues, these cause pain, etc. And that's when she started doing myofascial, release and then dry needling in these specific areas. And she called it, quote, dry needling because she's putting a needle in and there's no medication, so it's completely dry, right? So that's how the term was coined in the 80s. She started working with other physicians and put out a book, which is now, the myofascial textbook that everyone uses, and she did that. However, that's where the controversy comes, right? Is this a dry needling term that just discovered and started in the 1980s, or has this been used for thousands of years in acupuncture? They just called it something different, right? Either way, it works. So to me, I don't really care. But you're gonna have some people that say, well, dry needling can be used by chiropractors, by physical therapists, by doctors, by, everyone else, whereas acupuncture can only be used by licensed acupuncturists, right? They go through schooling, they go through training. It is there, they learn all those multiple different points, if you can imagine, right? That takes lots of study. So there's some people that say, I'd rather go to acupuncture by an acupuncturist. Some people say, hey, listen, we have Ryan and Elizabeth downstairs in physical therapy, and they do fantastic dry needling. Or Dr. Arrieta also does a different type of dry needling in her clinic. So we have multiple different avenues. I think the more the merrier, right? As long as you know how to do this properly, you're not putting the patient in harm, and you're getting good results. That's what we're wanting, right? Is less pain for our patients. So that's kind of where we're at now. The acupuncture versus, dry needling versus wet needling versus, there's lots of therapies out there for these myofascial or muscle spasm or points that are causing this chronic pain issue that is so prevalent in our society. Now, indications for use. Most of these, as you'll notice, are pain, muscular connective tissue pain. If you have restriction of range of motion, right? If you have shoulder pain and you cannot reach up like you used to, because those muscle fibers have caused tight or taut bands, right? And if they're not letting go, you would most likely see your doctor, your physician's assistant, whoever you normally see, and they might say, hey, go see my friend in physical therapy. They're going to do a full exam, and if they've been trained, they're going to say, we're going to do these exercises, we're going to do these stretches, we're going to do home stuff, but what do you also think about dry needling? So that's kind of where we're putting this in our toolbox. So it's not the only thing any of us are ever doing, but it's something else that can help. Soft tissue restrictions, right, such as scar tissue, adhesions. A lot of people that have had multiple surgeries on one area, whether it's the abdomen or a knee or anything like that, will know that scar tissue will cause significant problems if not properly taken care of. If you can imagine, you've seen these keloid scars, right? The hypertrophic, the scars that are really big and really ugly and gnarly and they're sticking out and it just looks like that scar tissue keeps growing. Well, inside it's doing that same thing. And it starts clamping down and it starts grabbing on things. And then you notice, well, I had surgery, but I just can't get rid of this pain. The pain could be caused from that scar tissue and adhesions inside. That we've used dry needling for that as well. And then trigger points have been identified in numerous diagnoses, such as all the ones listed up there. I will not read them because there's lots, but you get the point. There's headaches and muscle pain and back pain and all sorts of things. Now, because this is a procedure, it is not for everyone, right? That is why we always do a consult. We want to see who you are as the individual, what your issue is, and if this is even an option, okay? If you are pregnant, we do not recommend it, okay? Because it can release some hormones, you can get vasovagal symptoms, all that good stuff. So we usually say in pregnancy, we're very careful about that. If the patient comes in and says, Doc, I can't stand needles, I don't even want to talk about it, I don't want to look at it, you're obviously, that's a contraindication, right? I'm not going to put a needle in you if you don't like them. If you are unable to give consent, okay? If you're a 4-year-old, I'm not going to dry needle. If you come in and you cannot speak English with me, and I do not have a translator, or you are not cognitively able to hold a conversation and I know you want this done, you are not a good candidate, right? It just makes sense. I cannot get your consent. If it is a medical emergency, dry needling should never be on the table, right? If you come in and you're bleeding from a car wreck, that is not the time I'm going to pull out my needles and say, you know what you need is some dry needling. No, right? It is, so anything like that. If you have an infection like cellulitis, or you have a really recent scar from a surgery, anything like that, I will not do dry needling there. If you take anticoagulation and are an easy bleeder, like you accidentally cut yourself and it takes minutes, right, to recover, you probably are not a good option because, again, while bleeding is limited because the needles are so thin, it happens, right? I'm putting a sharp object into your skin. I have some patients that are easy bleeders. They understand the risks and they want to anyway. So again, that's why it's such a personal kind of thing. We're going to talk about risks and benefits, and are you the one that still wants to try even though you're probably going to end up bruising and bleeding a little bit? We'll do one spot and kind of see how you do. Or is it you bleed so much I'm not even going to touch you with that, so it's an individual personalized decision. If you have a compromised immune system, then you're probably not going to be able to do well, right, with extra things that are going into your skin. You have to be kind of healthy and robust enough to deal with a needle. So that's kind of what I'm looking at. When you come and see either myself or Ryan and Elizabeth in physical therapy, we're both going to be doing our exams. We're both going to be thinking in our heads, is this a good candidate? Would they be able to handle this? Would they get good treatment from this? Are they going to get good results? Etc. Now, when we go ahead with dry needling, because again, it is a needle, there are some risks involved. It is very common that you actually get some muscle soreness because we're aggravating the tender points, right? It is very common that you get discomfort at that area. Some people don't even notice. They say, Doc, don't tell me when you put the needle in, just do it. And after I have 4 in, they're like, when are you going to start? And then other people say, oh, I felt that, because they're very sensitive. So it kind of just depends. So you can have discomfort at that area. You can have soreness. Because it is a needle, you can have bleeding. Because, again, it's a needle going into the skin, there is a risk of infection. Now, we all clean the area very well. We're using alcohol wipes, we wear gloves, everything is taken care of to prevent any infection, but these are still risks that we have to be cognizant of. Now the first one up there is probably the most severe. It is a pneumothorax, which means that there is a little bit of a lung collapse. Because of that, and because of every practitioner that does this, we're terrified of that happening. We take extra precautions. If we are ever needling around the lungs, right, and the lungs kind of go down and they come up here, we're changing the angles, we're pinching the muscles, and that's where you say that guy up here on the shoulder, we're kind of pinching, and so we're able to control the depth of the needle, the angle that the needle is going at. We can pinch and make sure we're not going to go into the lung, we're just going into the muscle, but that is unfortunately happened to others. So those are risks involved. Now, I don't know how many have seen this comic before. I did find it originally with acupuncture, but basically it's a nice mammoth. You're like, huh, it's amazing how that works. Okay, so that is pretty much an introduction to dry needling. Again, I didn't want to go too technical into it, but hopefully that answered some questions, right, about what it is, how do we do it, how is it different than acupuncture, who might benefit from it, the risks that I need to know about before I decide to talk to someone about dry needling, and so on. Because we're getting such a great response, we're going to talk about the upcoming lectures.
I just had a couple of questions that maybe you could address. One, everybody is different in how they are going to respond to dry needling, but have you found that it usually takes more than one treatment? And so, what is the frequency typically, and is it weekly or whatever? And then secondly, addressing the insurance.
Sure, yeah, fantastic questions. Okay, so if you come and talk to someone about a consult, we're probably going to talk to you about what we think, how you might respond to the treatment, how often you need the treatment, and what our plan is for the entire treatment protocol. most of us that are dealing with chronic pain, right, and chronic muscular pain have been living with it for months to years. So one treatment will not create a miracle, right? This is another tool in our toolbox, just like physical therapy. If we continue to use it, it should get better. However, it will take multiple treatments. Depending on the severity of your injury and your pain level, I have some patients that start off once a week. Some patients say, hey, I can come every, Monday and Thursday. I'm gonna come twice a week for the first couple weeks and really knock this out. Then we're gonna cut back to 1 week, and then we're gonna come back to every 2 weeks, and then I'm gonna see you once a month. And then, hey, you might not see me for 6 months until I retweak my injury, etc. But that's our plan, right? Is that this is never you're gonna need this once a week for the rest of your life, and I'll see you every Friday. Because that would be horrible, right? Who wants to deal with that? So that's our goal, is definitely to try and fix and reverse what is happening to cause your pain. But again, because we are living with it for so long, our brain has been entrapped in this cycle of pain, right? That it's used to it. That is now its normal. So when you go and get a deep tissue massage and you feel good, you're like, oh wow, that really loosened it up. But 2 days later, it comes back. That's because the pain helped. But again, your brain is like, no, we need to go back. I'm creating this pain cycle again, because that is its new normal. We are trying to break that cycle and get you back. And that is unfortunately why you most likely need multiple treatments, once a week at the beginning. You can also do this with physical therapy. So if you're needing to go see physical therapy for your lower back or whatever reason, right, decreased range of motion, they're probably going to add that on as well. And it's usually once a week until, again, we see improvement, you get better, then it's once every 2 weeks, and then it's once every 3, however you want to do it. I have had, luckily, patients that have graduated from their dry needling and have not needed me since. They're doing their home exercises like we talked about, because they're having muscular issues in their legs and their back, and I said, listen, this is the issue. If we don't continue to work on it, then you're going to be right back in here. So they're motivated, right, because they don't want to experience that pain again, and so they're successfully treating their own pain and their muscle issues at home with supplements and Epsom salt baths and stretching and all that great stuff. Insurance. Now, because this is new and there are issues with who does dry needling and who pays for what, insurance does not always pay, and so some people are seeking this out with cash. Some newer insurances are saying, hey, that sounds more like manual therapy, or it sounds like physical therapy, and this physical therapists have taken this course and they have been certified. We're going to lump it in under physical therapy. Some people say, or some insurances say, we don't cover physical therapy or ancillary services, you need to see a physician. And if the physician chooses to do this treatment or therapy, then we'll cover it. So unfortunately, because there are hundreds of insurances out there, I cannot tell you which each one is going to tell you. I will say that I know Medicare does not cover dry needling as of right now. I don't know about supplemental insurance, secondary, right, to Medicare, but I know that the clinic, if we are going through myself as a physician doing dry needling, we are having patients with Medicare only sign a form because we know they're not going to cover it, and so it's going to be cash based. But like I said, there are now hundreds of other insurances that do half of it. Some insurances say you can only get this done by physical therapy, whatever it is. So we're having patients call their own insurances and say, hey, what's the deal? What do you guys cover? Dry needling. They'll be able to give you an answer specifically to your own insurance. And they will say, listen, Cindy Lou Who, you got to go see Ryan downstairs in physical therapy. Then you say, done, I'll go do that. You call up, say, Dr. Arrieta, I need you to send me to physical therapy for dry needling. And I say, perfect, right? And we all get you the care that you need that insurance is going to pay for.
Does the cost vary?
The cost vary.
Does the cost vary for the treatments?
So,
per individual?
sure, so usually not. So the way that we're doing it in the clinic, it is one cost if you see me, right, for dry needling and you have Medicare. We have a paper that you sign because we know they don't already cover. If you have a supplementary, or if you come in and say, hey, I have Blue Cross Blue Shield, I want this billed to my insurance, then I don't know, we're still working on billing the insurance first, right? And trying to see how
Can you
that
give
covers.
me a cost, I mean, the price?
Sure, yeah, so $128 for cash-based for Medicare patients. Now, I imagine that's the same across the board, but like I said, if you have different insurance that covers it, then, you know, it might cover it completely. Yeah. Yes, ma'am.
Does the placement of the needles vary with the condition that the patient comes in with? I mean,
Sure.
or do you always place them in the same area? Or
No.
does, oh,
Yeah, so good question. So would the position of the needles change for the individual patient, right? Absolutely. So if you're coming to me and you have, I have a patient that just got into a car wreck a couple months ago, right? And if you can imagine, a car wreck, it causes a lot of pain, a lot of clamping down, muscle spasms, etc. We started off at her most severe areas, right? Neck and shoulders. As those continue to get better, each day I would say that she'd come see me, today what do you want me to focus on? Where are you having most of your pain? She'd say, oh, it's now moving down my back, or it's now on this right side, so every day is different that you're seeing me. As you continue to improve, we're hoping that this, again, resets that cycle of pain, so you no longer have that issue, and then we can then concentrate on pain that you probably didn't know you had, because this one was just way worse, right? You concentrate on where you're having most of your pain, and you forget that, oh yeah, my right knee also hurts.
How deep do the needles go in?
How deep do the needles go in? So it kind of depends on where you're having that tender point. If I am treating a thigh or a bottom or a hip, you know, where we have a lot more muscle and it's a deeper one, like you have a piriformis muscle in your buttock, and that likes to spasm and squeeze on that sciatic nerve, right? And then it shoots pain down. That's much deeper than if you had pain around your knee. So we have different size, like length needles, but we never go deeper than what we need to. Yeah.
So when it is that deep, you can't pinch it, but how do you identify where that point is?
Right. So how are we identifying really deep points if I can't really pinch it? And it's more of that rolling, like we talked about on that left side, right? And so once I kind of feel it and I'm able to kind of get my fingers around it and say, oh, there it is, then I'm able to kind of go down. Most of the time when I do dry needling, I start out actually with manual therapy and myofascial release with my hands and with tools, and then dry needling tends to be like a third step. Yeah.
Question.
Yeah.
I had dry needling on 7 trouble in my jaw, and it was so painful that I was supposed to go back, and I never did. They actually touched my bone.
Okay.
It was awful.
Absolutely. Yes, I am sorry. Yes. So she had an unfortunate situation with dry needling, right? Let's call it that. They accidentally touched the bone, right? And so if you can imagine when it stays in the tissue and the muscle, there's much less pain, right? Because you got that extra give. When you hit a bone, it hurts a lot more. It is not supposed to hit bone. It is not supposed to hurt it, so I'm sorry. That is truly unfortunate, but yeah, that's not a good. I would hope your second time with maybe a second practitioner would be better. Yeah. Yes, ma'am.
You had your list of when not to do it.
Yes.
You had lymphedema on there, you didn't touch on that.
Sure. So lymphedema is that extra chronic swelling, right? A lot of us will get it in our legs. The problem with chronic edema is that when we have extra fluid, we are starting to stretch out that skin. We could have leakage of fluid through those skin particles, right? Which then leads you to have more susceptibility to skin infections, etc. It is very difficult with lymphedema to get down to the areas that we need to because of those risk factors, right, of stretching out the skin, having higher risk of infection, etc., and finding exactly where I need to be. Yeah. Great questions. Alrighty, well, thank you guys so much. I'm gonna hang out for a little bit, so if you guys have any questions, any further questions, I'll be here. Otherwise, just